Okay, this is my Nurse 465 Preceptor case study by me. Next. Okay, I did my Preceptor at the emergency room at Burgess Health Center, and that is in Ottawa, Iowa. It's about 6 minutes from Whiting, where I live. So I did 12-hour shifts from 6:30 a.m. to 6:30 p.m. My biggest takeaway would be how to properly respond to emergency settings. It's good to have, just be patient and not freak out. Three things I learned: bring snacks because you never know when you're going to eat lunch. Don't be judgmental. There was a lot of nurses that would sit at the desk and talk about every patient that came in because it's such a small town that everyone knows one another. So I learned that's not appropriate and everyone hears you. Explain to your patient what you are doing. Don't just grab someone's arm and insert an IV on them. I mean, that would scare me. So explain to your patient, hey, I have to insert an IV. Are you okay with this? What would I change? Probably not getting COVID and finishing my hours sooner. So at the beginning of my preceptor, I got COVID, so I was out for a week and a half. And then my preceptor, she is pregnant, so she had a crazy schedule too, and it was just really hard for me to get my hours completed. Did it prepare me for the boards? Yes. More experience, the better. I learned from it. Does it solidify where I want to work? Not technically. However, it makes me aware I want to work in some type of critical setting like NICU, maybe the ICU, and I would consider the ER. Would I do it all over again? I would definitely choose Mercy One or St. Luke's ER as it's busier and faster paced setting. Just because the Ottawa ER, it's small, so you never know if your day's gonna be busy or if it's gonna be boring. Okay. All right. So the patient that I remember, he was a 50-year-old gentleman. He arrived at the emergency department due to shortness of breath. He reports no pain, but he was diaphoretic and he appeared anxious. His blood pressure was 120/78. His heart rate was 120 beats per minute with rest bursts of 22. The patient weighed 285 pounds and states he is the manager of McDonald's. Labs were taken and troponin level of 5.0. So what could this patient be experiencing, do you guys think, before I go to the next slide? That's not the patient in that picture. It's just a picture off of Google. So, as you guys knew, I'm sure, he was having a heart attack. So his cardiac output is decreased when there is an inadequate perfusion to the myocardium, inadequate impulse conduction through the heart, or malfunction of a heart valve. So my concept is central perfusion. So central perfusion is generated by cardiac output, the amount of blood pumped by the heart each minute, and I got that information from Giddens. Primary medical diagnosis. So he ineffective central perfusion related to decreased cardiac output as evidenced by weakness, bradycardia, shortness of breath, and altered blood pressure readings. This picture here on the left is really good. It shows the artery and then it shows how it's blocked and it turns into plaque. So the patho, a heart attack occurs when an artery supplying your heart with blood and oxygen becomes blocked. Fatty deposits build up over time, forming plaques in your heart's arteries. If a plaque ruptures, a blood clot can form and block your arteries, causing a heart attack. Primary signs or symptoms that the patient had. So he had changes in his vital signs, typically low blood pressure and fast heart rate. He had shortness of breath from probably the insufficient oxygen since his artery was blocked. Other possible symptoms for anyone with a heart attack, they could have pressure, tightness, pain, or a squeezing or aching sensation, nausea, indigestion, heartburn, fatigue, or dizziness. I was surprised that he didn't have chest pain. He was literally just relaxing in the bed, just chilling, completely normal. He just, yeah. So assessment data, just a little side note, each minute after a heart attack, more heart tissue deteriorates or dies. Restoring blood flow quickly helps prevent heart damage. So obviously, like the faster, the better. Labs, cardiac enzymes are important for this. So troponin, and like I mentioned, his troponin was 5, which is very high. CK, CKMB, myoglobin, medications, MONA, so morphine, oxygen, nitroglycerin, and aspirin. They did make him chew to aspirin, and he asked to swallow it because he just got new dentures, but they did make him chew it. Bolus 60 to 70 units per kilogram. Diet NPO, just because soon they're trying to get him into that cardiac cath and they don't want them eating. They also did a chest x-ray on him and EKG. Nursing interventions, monitor the patient closely for changes in cardiac rate and rhythm, heart sounds, blood pressure, chest pain, respiratory status, urinary output, changes in color, skin color, and lab values. So really monitor him closely. This is a good YouTube video I want you guys to watch. Oops, I clicked on it like 3 times.
Hey, so we're all done with what you need us to do. Is there anything else that you need help with? Are you okay?
No, I don't feel so good. I'm kind of nauseous.
Okay, well, I'm trained with first aid. Is it okay if I help you? Okay, go ahead and sit down for me. Easy.
My jaw's been hurting too.
How long has this been going on for?
5-10 minutes.
Can you go call 911, please?
Oh, no.
No, it's okay. It's all right. We need to make sure you're all right.
A heart attack is one of the most common adult medical emergencies. It is critical to recognize and respond quickly to a heart attack because it can lead to cardiac arrest. What is a heart attack? The coronary arteries supply oxygen-rich blood to the heart muscle to keep it alive. Over time, fat and cholesterol can be deposited in the walls of the arteries, narrowing the vessels. A heart attack usually occurs when a clot blocks a narrowed coronary artery. The affected heart muscle begins to die due to lack of oxygen. This may trigger a fatal heart rhythm. The signs and symptoms are usually sudden, last for more than a few minutes, or may disappear and then return. The classic symptom of heart attack is chest discomfort, which can feel like pain, crushing, pressure, tightness, squeezing, or fullness. Signs and symptoms may also include discomfort or pain in the jaw, neck, back, one or both arms or abdomen, shortness of breath, sweating, feeling weak, dizzy, or faint, nausea, vomiting, pale or cool skin. Some women, older people, or diabetics may not experience the classic symptom of chest discomfort. They more commonly experience other symptoms such as back or jaw pain, nausea or vomiting, unexplained fatigue, and shortness of breath. If any of the signs and symptoms are present, call 911. Send someone to get the first aid kit and AED. Place in a position of comfort, usually sitting up, calm and reassure them. Offer aspirin while waiting for EMS responders. Give either 1 regular or 2 low-dose uncoated aspirin. During a heart attack, aspirin can improve the chance of survival. It's not for everyone, though. Make sure there is no history of aspirin allergy, signs of stroke, or recent stomach or intestinal bleeding. Time is critical. The sooner a heart attack victim receives medical care, the less damage to the heart and the better the chance of surviving a heart attack.
Okay. Psychosocial concerns. Obviously, he had a lot of fear. So he was 55 years old. This is something new to him. He's never experienced heart problems. So he's unsure of what is happening to him. He may not know if he will survive or get better. He's really uneducated about the situation, so that's where fear comes in. Goals. So short-term goals. The patient will verbalize reduced anxiety and fear after 15 to 20 minutes of administered morphine. The patient will stay on bed rest with the backrest elevated throughout emergency room stay. Long-term, the patient will have reperfusion to cardiac muscle and return of cardiac muscle functionality or as much as possible after the stent is placed. Another one, the patient will be educated on the disease process, treatment plan, and understand prognosis before discharge. Interventions, the nurse will continuously monitor EKG for changes in cardiac rate, heart rhythm, and conduction. The nurse will also assess vital signs, especially pulse and blood pressure, every 5 minutes until the pain subsides. I mean, my specific patient didn't have pain, but it is common for a heart attack with pain. Patient education, lifestyle factors are very important. Maintain a healthy weight, heart healthy diet. So my patient was obviously obese. He is the manager of McDonald's, so he probably isn't eating the healthiest. Don't smoke, exercise regularly, and manage stress. As a manager, it's going to be stressful. Control conditions that lead to heart attack, like high blood pressure, high cholesterol, and diabetes. And I got that education from Giddens. And these are the sources that I use throughout my PowerPoint. All right, thank you. I hope this worked because the first one I sounded like Darth Vader.